So we welcome not only you, but all those who are joining us from various places around the globe. Our program is basically divided into 4 sections. We'll start with opening remarks, followed by 2 basic introductory presentations about the collection. And we'll then have a discussion period and a break. After the break, 3 of the senior authors who prepared papers in the collection will give you a more in-depth review of their work, again followed by discussion and some closing remarks then by Tessa Wardlaw from UNICEF. So without further ado, I would like to introduce our first opening speaker, who is Elisabeth Fox, who is the director of the Office of Health, Infectious Disease, and Nutrition at USAID. Elisabeth.
Thank you, Jennifer. Thank you, Jennifer. Thank you, everyone. And you're right, this always happens on a rainy morning. I don't know why. But thank you so much for having me here today. It's really an honor to be with so many noted academics and health experts, especially our partners from UNICEF, Johns Hopkins University, the Bill and Melinda Gates Foundation, PLOS Med, Tulane, the University of Edinburgh, and MCHIP, and of course, ICF International. Good morning, Fred. Nearly 30 years ago, UNICEF and USAID, with the support of the US Congress, launched the Child Survival Revolution, aimed at reducing the number of deaths among young children in developing countries. At that time, an estimated 15 million children under the age of 5 in the developing world died every year from common preventable diseases. If the world had done nothing, today that number probably would be 17 million. Instead, in 2011, it was 6.9 million. This progress, and the ability we have to measure it, gives us great hope for success in the future. For most kids, the difference between life and death hinges on the ability to fend off devastating killers like pneumonia, diarrhea, undernutrition, malaria, vaccine-preventable diseases, and HIV/AIDS. At USAID, across our global health portfolio, we are aligning our budgets to the areas of greatest need. 90% of our child and maternal health funding, our bilateral funding, now is going to the 24 USAID priority countries that account for 3/4 of maternal and child deaths every year. We couldn't do that without good measurement. We're funding critical efforts in voluntary family planning, immunizations, nutrition, malaria, tuberculosis, and neglected tropical diseases. Cost-effective interventions that save lives while preventing the spread of disease. Through USAID Forward, you've all heard of that, the agency has fostered new partnerships, placing greater emphasis on measurement, evaluation, innovation, and a relentless focus on results. The discipline of development demands a strong practice and use of monitoring and measurement. Evaluation is a crucial tool to inform our global development effort and enable us to make some pretty hard choices based on the best available evidence. And today in Washington, you all know about hard choices. Findings inform decisions, improve program effectiveness, help us to be accountable to stakeholders, and more importantly, support organizational learning. USAID uses monitoring and evaluation data to ensure that intended outcomes and impacts are achieved. Data also helps us demonstrate that the agency is accountable, transparent, and an effective steward of public trust and resources. As a key element of continuous learning, we use monitoring and evaluation to inform data-driven decisions at all levels. Of special note are the large-scale population-based household surveys that inform our work in health and have informed it for many years. We began funding the demographic and health surveys in 1984. Since then, it has provided technical assistance for more than 260 surveys in more than 90 countries, advancing global understanding of the health and population trends in developing countries. DHS has earned a worldwide reputation for collecting, analyzing, and disseminating accurate, nationally represented data on fertility, family planning, maternal and child health, gender, HIV/AIDS, malaria, and nutrition, and I should say, and more. Recognizing the importance of DHS data, other donors and participating countries now also contribute to the surveys. National health accounts are supported by DHS as well, so that public and private health spending can be better understood and managed. To complement information on all-cause mortality from nationally represented household surveys, like the DHS and the UNICEF-supported mix, USAID supports efforts to model the effects of various child survival interventions on malaria-related mortality. LIST, the LiveSaves tool, the current standard tool for modeling deaths averted, is based on earlier work on the effectiveness of interventions by WHO Child Health Epidemiology Reference Group and Rollback Malaria's Monitoring and Evaluation Reference Group. The model predicts the number of lives saved due to different interventions, making assumptions about the cause of death profile in a country and under 5 mortality and current coverage of child health interventions. The model also builds in assumptions about the effectiveness of different interventions in reducing cause-specific mortality. And I can tell you that today for our PMI program, the Presidential Malaria Initiative, this is crucial, and having this data is crucial for our continued funding. USAID also contributes to the global state of knowledge on health in developing countries and on the effectiveness of health interventions through the generation and use of data for innovation and learning. We provide support for country-specific demographic and health surveys, strengthen local-level systems for disease surveillance and pandemic outbreak monitoring. We all know about that today, and develop globally accepted monitoring and evaluation decision support tools. Measurement, and especially measurement of coverage, our topic today, is key to improving equitable access to quality services, strengthening country-led strategies and learning agendas, and especially capturing important details and nuances as we chart the way forward in child and maternal death. With the intense and spirited commitment of host countries' governments, donors, other stakeholders, rigorous monitoring and measurement, we can make significant and sustainable improvements in the lives of millions of women, newborns, and children. And that's our topic today. Thank you very much.
Thank you, Elizabeth.